We turn now to the coronavirus pandemic. The U.S. has administered more than 200 million vaccine doses. According to the Centers for Disease Control and Prevention, more than 80 million people, 24% of the U.S. population, are now fully vaccinated. And more than 127 million people have received at least one dose. Despite progress on the vaccine front, the head of the CDC is sounding the alarm as variants fuel a surge in new cases. Mola Lenghi reports.
Tonight, health officials are on high alert after an alarming rise in COVID cases, with infections increasing in more than half the country and deaths up 11%.
The increasing trends in cases, hospitalizations, and deaths are very concerning, and they threaten the progress we've already made.
One big reason, variants, particularly the one that originated in the United Kingdom. At this Columbia University lab, Dr. David Ho first identified yet another variant circulating in New York City.
It's concerning because it's spreading at a rate that is on par with the UK variant, and we know the UK variant is more transmissible and more lethal.
It's being blamed for nearly half the new infections here in the past week. New York State has the second highest number of new cases in the country, something Governor Andrew Cuomo addressed today.
It is not over. It is better, but it is not over.
And now the CDC says they're investigating 2 more cases of blood clots in people who received the Johnson & Johnson vaccine, including one from the clinical trial, another woman and a man. This after 6 women had similar cases, resulting in the pause in distribution.
We recognize the critical importance of moving quickly.
In a statement released today, J&J says so far, evidence is insufficient that its drug was the cause of the clots. Still, there is concern it's scaring away the unvaccinated. After months of demand for shots outstripping supply, the situation in some areas is now reversed. Thousands of appointments at vaccination sites in New York and Chicago are unfilled, as the country continues to brace for what's next.
Based on everything that we know, what's the outlook this summer?
Well, I think the good news is vaccine rollout is moving along at a great pace. The bad news is the variants are emerging everywhere.
Here in New York, roughly 5.4 million people have already been vaccinated by the state. Meanwhile, the White House said today it's likely that additional booster shots will be required in the future, and they're planning for it. Lana?
Mola, thank you. Dr. Teresa Amato joins me now. She is the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, thanks for being here, and thank you for all that you do. So, variants have been fueling this recent increase in cases here in the U.S. How are things for all of you folks on the front lines?
So this time around is a little different than last spring. Where we were last spring when the first hit of the pandemic, being the epicenter in Queens, it was like a tsunami. It came in very suddenly. Within a few days, we went from just a few cases to several dozen to hundreds to thousands. People critically ill very, very quickly, filled up the hospitals. Really like a very quick onset, I would say, and like a deluge. And it very quickly went out the same way it came in. We saw this sudden drop in cases, and we had a little bit of a lull. This time around, it's been very different. I tell people it's sort of a slow and steady burn, if you will, seeing an increased number of cases, and then we sort of didn't really fall off. We just kind of stayed steady for several weeks. Saw some good news over the last few days, I would say, where we're starting to see a steady decrease. Still not going as quickly as it did last time, but definitely starting to see a decreased number in the ICU patients and the admitted patients. Getting a little concerned because I am seeing quite a few people that are coming in with symptoms that we call them treat and release patients. We're able to send them home. Quite a few of them are in the older adult population, and due to hesitancy, did not get the vaccines and unfortunately are fairly sick. The good news is we do have some treatments for them. We have the monoclonal antibody infusion, which we can give to our older adults to try to dampen down their experience with COVID so that they don't get hospitalized or in the ICU. As more of us are getting fully vaccinated, the frontline staff, I've been able to give some of my crew some days off, and they can now travel domestically. So trying to get them some R&R so they're ready in case we get some more cases.
Well-deserved R&R, certainly. And so, Dr. Amato, you mentioned the vaccine hesitancy, and there's been some discussion about the Johnson & Johnson pause and whether that is fueling additional hesitancy. The current status right now is that a CDC advisor says that experts still need more data before they're able to make a decision on the Johnson & Johnson vaccine and putting it back into the public. But what kind of information are they still looking for?
Well, I found it very interesting when they first put out the data that there was the six people that had these blood clots were all women of childbearing age. And I found that very interesting. As an emergency physician, you will see these venous thrombosis, but they're very, very rare. And the very few times that I've actually seen them were in women of childbearing age that were at risk for clots, regardless whether they were on birth control pills or immediately in the postpartum period, just had a baby, which you're in a very hypercoagulable state at that point. And those are the only times I've ever actually seen this in the clinical arena. So I was a little bit taken aback when I saw that it was 6 women of childbearing age. I think we have to make sure there's not some other co-founding issue that would put them at a higher rate of getting these clots. But the other interesting thing is they all had something similar, which was a drop in platelets. So that you don't normally see when people get these clots for other reasons. So it's really hard to say right now whether this is the vaccine or there was some underlying reason they had these clots. To play devil's advocate, though, what we did see is people in after COVID or immediately after COVID were also at higher risk for getting clots. So suddenly we were seeing people with clots in their lungs called a pulmonary embolus who had no risk factors other than having COVID. So I think they really have to weigh the risk and benefits. Right now, it seems like this is exceedingly rare, but there may be some advice they're going to have to give to people that would be at a higher risk for clotting and discuss the risk and benefits of the vaccine itself.
That's really helpful background information. Speaking of these vaccines, as I mentioned, we're less than 20 million doses away from reaching President Biden's goal of 200 million coronavirus shots by his 100th day in office. What's your take on the pace of vaccinations?
Well, I think, I had a couple of concerns when they pulled the J&J, and I have to say, I think the FDA did the right thing. They have to really, they have to be extremely cautious right now and make sure that this vaccine is safe. So as hard as it was for me to hear the news, I can understand why they felt the need to put a pause. But I think it may be driving some people now towards more hesitation to getting the vaccine, which is very unfortunate. We still know that the vaccines are safer than getting COVID as far as having adverse effects or death. So I would still encourage people. There are shots available now. I hate to see those slots go open. My family is almost entirely vaccinated right now, and it has made the world of difference. We can start to see our new normal again, being able to socialize a little bit more. Again, we were able to domestic travel. It really does give you some freedom to do some things. However, we're still mask wearing when we're out of the house, and we're still keeping our social circles small. But we are starting to feel with the vaccinations that we can really kind of get back to our lives. So I still encourage people, speak to your doctor if you have any concerns, but to really encourage people to consider getting the vaccine, especially now that it's more available.
Dr. Amato, since you brought up your family, I want to ask, because I know that you have kids, you're mentioning traveling again and starting to get back to normal, though you're trying to stay within those recommendations. How concerned are you about the younger members of your family who are not yet eligible for vaccines?
So luckily, of my 6 children, 5 are eligible. So they're all getting vaccinated, just my youngest. And I am hoping that by this summer, they will lower that rate. She'll be 13 in the summer. So we're hoping by the summer into the fall that they'll be lowering the age to 13. But I'm fortunate that my children are a bit older, so they've all been eligible to get vaccinated. I think it is very difficult for people who have small children. You can get the vaccine, but your children can't yet. The good news is most children don't get too sick with COVID, so I can understand the reasoning of trying to get older adults and people at risk earlier. And also looking at the data for safety for children. So I'm really hoping that by the summer, it'll be an open door for kids to get the vaccine as well.
Well, sending best wishes for your family as well as everyone's families. Before I let you go, I want to ask you about these breakthrough infections. The CDC says that there have been around 5,800 cases of infections in the U.S. for people who have been fully vaccinated, but nonetheless have contracted the coronavirus. Help to put this into context for us. We know that having the vaccine doesn't mean that you become 100% immune to the coronavirus. What more have we learned from these patients?
Yeah, so, I think there's a couple of things at play here. Not everybody is going to be able to mount a robust immune response to the vaccine. I'm talking about people that are on immunosuppression medications, whether it's for an autoimmune disorder or they're a transplant patient. Older adults sometimes have trouble mounting strong immune responses to vaccines. So there's always going to be some people that are going to be very vulnerable despite the fact that we're vaccinating them. That's why the herd immunity becomes super important, because the more people that are vaccinated, the less the transmission, and we're trying to keep those people safe. That being said, even people who have normal immune systems, it doesn't get you a get out of jail free card. It gets you a safety net. So we're hoping that even if you were to get COVID, you won't get as sick because you'll be able to mount an immune response to it. And we knew from the beginning that, it's 95 to 98% effective, but you're vaccinating literally millions of people. So when you're vaccinating hundreds of millions of people, that 2 to 5% is a pretty big number. So that's why we're still encouraging people that despite being vaccinated, that they wear their mask and socially distance.
All right, Dr. Teresa Amato, thank you.
Thank you.